In medicine, we have a term for the moment when all the individual pieces of a clinical puzzle finally assemble into a coherent picture, the synthesis. This is that episode. We have examined the cardiovascular system, the neurological findings, the sleep architecture, the psychiatric and cognitive symptoms, and in our most recent and most significant episode, the incontinence findings that have reorganized our entire diagnostic framework. Now we put them all together, the way a tumor board, a multidisciplinary team, or a White House physician would have to, based on the totality of publicly observable evidence, organized through the framework of evidence-based clinical medicine, leading the primary differential. Normal pressure hydrocephalus. NPH elegantly unifies the three cardinal findings of Hakim's triad, the gait disorder, the cognitive impairment, and the urinary incontinence, into a single, mechanistically coherent explanation. The enlarged ventricles compress the motor fibers controlling the legs, the frontal lobe circuits, and the paraventricular pathways, all simultaneously. Co-primary spinal consideration, cauda equina syndrome secondary to probable lumbar spinal stenosis. The bowel incontinence, the finding that elevates this from theoretical to urgent, is most parsimoniously explained by compression of the sacral nerve roots. As a spine surgeon, I can tell you this finding demands an MRI of the lumbar spine. If cauda equina compromise is present, it is a surgical emergency. Underlying neurodegenerative co-pathology, mixed Alzheimer's and vascular dementia. The duration and trajectory of the behavioral and cognitive changes establish an underlying neurodegenerative substrate that predates the motor findings. Systemic accelerant. Severe obstructive sleep apnea, driving chronic nocturnal hypoxia and cumulative white matter injury. Cardiovascular. Hypertensive heart disease with probable atrial fibrillation, the upstream generator of vascular cerebral injury. Let us be honest about prognosis. The picture's not favorable, and the incontinence findings move the timeline forward. If NPH is identified and shunted, meaningful functional improvement is possible. Gait may improve, urinary control may partially recover. However, and this is the clinical reality, the years of escalating behavioral changes and speech patterns argue for established coexisting neurodegeneration. The vascular disease will progress. The trajectory is toward increasing heart failure severity, increasing arrhythmia burden, and elevated stroke risk. The appearance of sphincter incontinence is not a beginning. It is a milestone, indicating a disease process that has reached advanced territory. I want to pause here and speak specifically to any medical professionals watching this. If bowel incontinence is genuinely present, cauda equina syndrome must be ruled out immediately. This is not a condition that can wait. Acute cauda equina compression is a surgical emergency. The window for recovery narrows rapidly. If this has been documented in a sitting president and an MRI has not been obtained, that is a failure of medical care with governance implications. I want to be very clear because this is the segment that moves beyond medicine into what I consider a solemn civic obligation. The 25th Amendment exists precisely for scenarios where the capacity of a sitting president to discharge their duties is in question. This is a description of moderate to advanced multi-system neurological failure. The specific governance risks of frontal lobe dementia are not abstract. Impulsive decisions in high-stakes environments made without the capacity for second-order reasoning, inability to integrate contrary advice. A nuclear-armed democracy governed by an individual in advanced decline is not merely a health story, it is a civilizational risk management story. Here is the updated physician's guide to the public signs that would indicate significant progression, acute deterioration, or crisis. Immediate red flags. Any acute onset of new neurological symptoms, sudden confusion, vision changes, or new limb weakness. These are medical emergencies. Short-term warning signs, increasing visible confusion in unscripted settings, growing reliance on scripted remarks, management failures in public. Medium-term progression indicators, measurable decline in verbal fluency and sentence complexity compared to video baseline. Spatial disorientation. The progression toward severe dementia with profound functional dependence is measured in months to a few years, not decades. Each event accelerates that trajectory. I have spent this series trying to be rigorous, fair, and bounded by what can be responsibly inferred from observable public evidence. The American public and the global community deserve transparent, independent, and verified medical disclosure from any individual who holds this level of power. Not because of politics, because of physics. A nuclear arsenal does not distinguish between a cognitively intact order and a confabulated one. Watch carefully, think critically, ask the questions that the press has been reluctant to ask, and demand the transparency you are owed. This has been our 7-part medical analysis series. Thank you for watching, and please, share this with someone who needs to think about it.